name is Dr. Anne Kagia. I'm going to be the moderator for this session today, and I'm happy to introduce Dr. Koki Muli Kinagwi, who is a County Director at UCSF Global Program for Research and Training. So I'm going to give her, to let her go ahead and present. Then thereafter, we can have a session of discussion and questions and answers after her presentation. Thank you. Dr. Koki, kindly go ahead and share your slides. Thank you. And welcome.
Okay, thank you, Dr. Anne. Good evening, everyone. Let me share my screen. Yeah, can you all see my screen well? Dr. Anne, I believe my slides are showing.
Yes, sorry, we can see your slides. I was just reading your heading.
Okay.
Sawa.
Great, thank you. So I'll be sharing tonight about this study that I did that was exploring gender discrimination, sexual harassment, and workplace inequality faced by female doctors in Kenya and its effect on specialty choices. So gender discrimination, sexual harassment, and workplace inequalities are some of the major barriers that women professionals have to bear with in their careers, and really not just in the medical profession, but just generally. There are some significant barriers and challenges that women continue to bear with, and we have limited numbers of women rising to senior levels, irrespective of the field of medicine they are working with. So when you look at it, you'll be able to see that a lot of women still do not get to the senior levels. There's a very small percentage who do. So the question is why? So when we talk about gender discrimination, we want to define it as any distinction, exclusion, or restriction made based on the socially constructed gender roles and norms that prevent a person from enjoying full human rights. And sexual harassment, we define it as unwelcome sexual advances, comments of a sexual nature, requests for sexual favors, or comments about an individual's gender, which really ends up creating a hostile work environment. It can also be, highlighting the sexuality of someone in a manner that makes them uncomfortable and denies them the opportunity to enjoy life freely. So that's what we would say. So when you talk about sexual harassment, that's what we need to think about it. Gender equality, on the other hand, when we talk about it in the workplace, what we are looking at is a place where men and women can enter the health occupation of their choice. They will develop the requisite skills and knowledge, be fairly paid, enjoy fair and safe working conditions, and advance in a career without reference to their gender. So that's what we need. When you talk about equality, that's what you're looking. It doesn't matter whether you're a woman, a man, at the end of the day, you're able to get the skills, you're fairly paid, you enjoy a good working relationship, and you can advance as much as you want to without any limitation. So let's look at the context here in Kenya. These are statistics from 2019. We had a total of 8,697 registered doctors in Kenya. And when you look at the distribution, 60% of them were male doctors and 40% were female doctors. And if you look at it by gender, let's look at the top graph first, the one in the bottom one for 2014. Out of all the general practitioners that were there, 60% of them were male and 40% were women, which is more or less in line with the distribution of the doctors overall. But when you go to the specialists in 2014, 80% of the specialists were men and only 20% were women. 5 years down the line in 2019, when you look at the general pool of general practitioners, we had 56% of them being male and 44% being women. And specialists, we had 69% of the specialist doctors being male and 31% being female, showing that there was an increase in the specialist women from 20% to 31% over a course of 5 years. But if you look at the second graph down, which is now just looking at, if you look at the total pool of male doctors, you'll see that 65% of them are general practitioners and 35% of them are specialists. When you compare that to the women, you have more of them being general practitioners, that's 77%, and the specialists are only 23%. So these are 2019 statistics. So it is evident that there is occupational gender segregation within the medical profession. And so what this study was aiming to do is just to explore some of the factors that may be contributing to this situation. And we also know, as we keep on hearing about gender discrimination, sexual harassment, and workplace inequality, we realize that it is faced by women doctors, and the impact of that really cannot be understated. And these behaviors have consistently come up as barriers to the progression of women in their medical careers, as well as even determining the specialties they'll end up with. And this is with little regard to their strengths and aptitudes. So you may have strengths in particular clinical areas, but because of what happens, that ends up being not the career you go for. So this study was just trying to look at that and see what is happening in the Kenyan situation. And this is because a lot of the studies that have been done looking at gender discrimination and equality among female doctors have been outside the African continent. And there have not been many studies done within Kenya and even within Africa and even Kenya to explore this. So this was what the study was aiming to do. Can we just start to explore, see what is happening and figure out, can we get some information that can help, remedy the situation? So the general objective for this study was to explore the occurrence of gender discrimination, sexual harassment, and workplace inequality faced by female doctors in Kenya and its effect on their specialty choices. So the first specific objective was really to assess the extent of gender discrimination, sexual harassment, and workplace inequality faced by the female doctors. And then secondly, establish the effect of gender discrimination, sexual harassment, and workplace inequality faced by the doctors on their specialty choices. Does it have an effect on that? And then number 3, to make recommendations to assist in addressing gender discrimination, sexual harassment, and workplace inequality faced by female doctors in Kenya. And the aim was, if we look at this is probably something that can even go just beyond female doctors and into the bigger health space and where health workers is. So this was really to try and open our eyes to what could be happening, and I guess opens the door for many other more detailed studies to take place. So the methodology was, it was a descriptive study targeting Kenyan female doctors. So I looked for female doctors who had studied in Kenya and who are working in Kenya. So I had a total of 83 female doctors who participated in this study. The data was collected through self-administered questionnaires. I got IRB approval and a research permit, and I collected data between September and October 2022 and analyzed the data using SPSS. So let's look at the results. So out of the 83 respondents, the majority, that's 71%, were women falling in the age group of 30 to 39 years, while 28% were in the 40 to 49 age group. So these are people who've been practicing for quite a bit, because you can see the majority, 38.5%, had between 6 to 10 years working experience, while 37.3% had between 11 to 20 years experience. So the majority were female doctors who've worked in this field for a long time and can be considered to be relatively senior in their careers. So let's look at the respondents' experiences. So how I've chosen to do this is I'm going to share the findings and also share the experiences in the ladies' own words, what the women doctors actually said, because I feel that will really pass the message about what is happening in our workplaces. So 69% of the respondents reported experiencing difficulties in their career because they were female. So there was one who said, I was bypassed for a promotion when I went for maternity leave. A male colleague, junior to me, was made head of a unit I had worked in for several years, yet he was newly recruited. Yet another one said, I have been discriminated against as an intern by other healthcare workers, like ward nurses in the medical ward round would not join me for ward rounds, yet they would join my male colleagues. Another one said that there was unavailability of hospital transport at night when I was on call. I was often required to walk at night from my house, which was about 3 kilometers from the hospital. This exposed me to dangers like rape and other assaults, which were common in the area. Her male colleagues probably walked and didn't see the big deal with the walking, but for her, this exposed her to these dangers and no one took it seriously despite it being raised. When I was much younger as an intern and a medical officer before I got married, some of the senior male doctor colleagues would make passes at me, even though they were married with children. My contract was not renewed because I was going on maternity leave. And so this doctor was denied her service charge and her 1 month salary in lieu of notice, which is actually against the law, but it happened. And yet another one was fired because I got pregnant and needed maternity leave. These are words from female doctors. These are actual experiences that they have gone through and they put them in this study. And, so it's something that we need to take note of because this is not wishful thinking. These are things that actually happened. Then another one said, I've had sexually explicit statements thrown my way by my boss. And, nothing happens. Even if you report, it would still happen. Sorry, let me go back. There's one there that, sorry. Yes. Sorry, let's just go back. There's something we have skipped. Okay, so this one was saying that, I'm having a problem with sorry, there's a little technical hitch. Just give me one moment. Something is going on. Okay, this is where we were. So there's somebody who said that they had sexually explicit statements thrown their way by their boss. And this was in the workplace and nothing was done about it. Then there's also harassment by male colleagues. They presume what they do to be playful banter without realizing that they make the workplace unsafe for female colleagues. So there's a lot of sexual harassment that goes on, the talk, innuendos and so on. And it's taken as, just play, but it really does make the workplace unsafe because it is unwanted. And remember, we define sexual harassment as unwanted sexual comments and so on. So that has been happening. Then regarding the effect on specialty choices, 46% of the respondents said that, the way they were exposed to gender discrimination and sexual harassment affected the specialty they ended up choosing. They may have wanted to go for one specialty, but because of what happened to them, they would choose another one. And these are some of the things they said. When I was a medical officer, I was moved to a different department because I refused advances from a consultant in that department. So while she would have liked to continue working in that department, it was not possible because she was moved. And so, of course, you now start to get different interests depending on where you were taken. Another one said I was being overworked as my male colleagues were sometimes unreachable when on call due to drinking. So if you're being overworked, of course, you will now not really want to continue working in that area despite having that interest. So that had an effect on the specialty they eventually chose. Then there was a significant association between sexual harassment and both undergraduate and postgraduate medical training. And this was across the board. Initially, I thought maybe it was more undergraduate, but actually it's both undergraduate and postgraduate training. So there's a female doctor who was failed in her exams by a professor who had asked her for sexual favors, and she declined. Then another one said that her release for postgraduate training was delayed while other male colleagues proceeded for training. So here you are, you want to proceed for your postgraduate and everyone else is being released except you. And you're the only female in the unit. Of course, that is discrimination. Then I have received unwanted hugs and pecks from my thesis supervisor. Again, unwanted. Yes, the supervisor may have been very happy that she has done well or she's progressing well, but you cannot give unwanted hugs and pecks. So that again was an issue. So from the responses received, it was clear that sexual harassment was experienced during both undergraduate and postgraduate medical training. And while the majority of the respondents reported that they had not experienced sexual harassment, many of them said they had observed it taking place in the workplace as well as during undergraduate training. Then 93% of the respondents said that there was continued gender discrimination and sexual harassment in the workplace today. So we're not just thinking of what happened when they were in training, but even now as they are working, it is continued. So men were being favored and their decisions respected over mine, despite us being equals. So you're in a workplace where, your decisions are basically not being considered, or even your suggestions, they were not being taken seriously as that of male colleagues. Yet sometimes it's the same point. You find a female doctor has made a certain suggestion, but only until another male doctor repeats it, is it taken seriously. That is discrimination. And then there's, of course, the underpaid. I am underpaid compared to my male colleagues. You have all the same qualifications, you're doing the same work, but when you look at the payment, the salaries, you find that they are underpaid. And this is actually happening. So I asked them if they felt well supported as a female doctor in their workplace, and only 56% said they felt well supported. That leaves us with 44% who feel that, really the workplace is a challenge. And that's a significant number. Let's see what some of them said. I was once shouted at in a board meeting by all men. This is a board meeting. You're discussing serious issues. Yes, disagreements may arise. You may have different opinions, but what you need to do is remain professional. So if you have all this, then this is really making a workplace, for lack of a better word, toxic. Then, of course, others will say, you're called names, that you're moody, you have dysmenorrhea, what's going on with you today. All of this being thrown about very carelessly. And what it does, it just really undermines the collegial working relationship, which is really not what you want to do when you want to get the best out of people in the workplace. And then there's one who also said, I carry a heavier burden of childcare and school-related activities than my spouse, who is also a medic. So again, you find that as female doctors in the workplace, yes, you have what you're doing in the workplace and the hospital, but even at home. And generally, we are carrying heavier burdens, and that needs to be considered. So, which areas have the most incidences of gender discrimination and sexual harassment? And so when we looked at the results, most of them, 53%, reported that the surgical specialties had the most incidences, followed by obstetrics and gynecology at 16%. So what are the recommendations? Because one of the aims of looking at this study and just exploring was to try and figure out, what can we do? Are we doing everything that is needed to address this, or is there more that we can do? So these are some of the recommendations that came up from this study. Is that one, we need to create an open environment that allows for whistleblowing and provides support for survivors of harassment. And this could really just be peer support, psychological support, sometimes mentorship, because then if, we're dealing with junior doctors and they can have mentorship from senior doctors, it helps you, learn to cope better and figure out what to do. So that open environment needs to be there, because then if you cannot talk about what is happening in the workplace, then you'll not be able to adequately address it. Then the other thing is that employers need to make it clear that gender discrimination shall not be tolerated, and sensitize all on what constitutes sexual harassment. And so employers need to make sure that they themselves, in the policies and the procedures and the things that they do, they are not entrenching discrimination, because sometimes it happens. And so it has to be very clear from the employer all the way down. This is not tolerated in this institution, and this is what we are supposed to do. And in case it happens, this is what is meant to be done to address the situation. Then we need punitive measures for reported offenders, So we keep talking, oh, let's have, talk trainings on sexual harassment, but it looks like it's just been done to tick a box for compliance. And somebody actually said it's like men don't get it, because if you've gone through these trainings, but you find the behavior is repeated, then you wonder why isn't it then not being actioned? So is it because there's no punitive measure so somebody can get away with it? Exactly what is happening. So that's one of the recommendations that needs to be done. Another recommendation was to make medical practice less toxic and to stop glorifying suffering, that you must suffer as healthcare professionals. This is a lot of work and, you cannot have it easy and so on. And that way, if we stop making it toxic, then everyone's contribution and the role will be well defined. There are gender differences that are there, but they don't have to be that pronounced because women must go on maternity leave. We have family responsibilities, but this should not be overly dwelt on because of a toxic working environment, such that when somebody needs to go on maternity leave, it becomes a big crisis. How are we going to raise the next generation if we don't have children? So we need to figure out how do we support, because I think the whole environment we are working in is not very supportive, and it makes everything then become very toxic and negative, and people get focused on the wrong things. Then we need to develop policies against gender discrimination and enforce them. We don't just want to have policies for the sake of policies or procedures for the sake of them, and we are not enforcing them. And then, of course, we need good systems to address the known or alleged cases of gender discrimination that allow for easy reporting and show consequences. Because unless there are consequences, that people will keep repeating the bad manners, keep treating people differently and badly, and because they know they can get away with it. Then again, the big thing about our society. So yes, we are a patriarchal society, and therefore a lot of men do not consider making unwanted sexual advances. Unwanted advances at a lady as sexual harassment. Yes, it will be sexual harassment if it is unwanted. So that needs to be clear. Yeah, so it may have been culturally accepted way back when, but we know right now in the world we live in, do not make unwanted advances. You could try, but if it's unwanted, then you stop, because you proceed with that, it is sexual harassment. Then we need to create more awareness about subtle discrimination policies that are thought to be normal. We have normalized some things that really is discrimination, that you expect that, once a woman goes on maternity leave, when she comes back, maybe she won't be able to pull her weight. She has to, take care of the children. You start to accept things as normal, but they are actually not normal. We are just entrenching discrimination. So we need to create awareness and be deliberate about getting the best from the female doctors. The country has invested so much in training, and so it becomes a shame if you cannot get the best out of people because of the environment and space that they have been placed in. And then allow female doctors to be able to speak up on any sexual harassment and gender discrimination safely. Yeah. And accept that this has been happening. I think this is a big one. I think we need to accept that it has been happening, because if you don't accept, then we are basically in denial, and you wouldn't be able to make progress. I think if all of us were honest to ourselves, we've been able to see a few incidences of sexual harassment happening where we are, or any forms of discrimination. So we need to accept that it happens and has been happening for a long time, and we need to make spaces safer for both men and women. Again, I know the focus of my study was on women, but that does not negate the fact that men could also be experiencing some kind of discrimination or sexual harassment, depending on the situation they find themselves. So we have to look at it from both genders and basically ask ourselves, am I going to be somebody who's standing by and watching this happen and not say anything? So we need men to be allies and speak up and challenge their fellow colleagues who are entrenching, sexual harassment or discrimination. Because at the end of the day, these are your colleagues. one day this could be your daughter who's going to be a female doctor. Would you want her to have the same kind of experience? So we have to look at this in the bigger sense and look at what are we, what kind of a society are we bringing up? Are we getting the best out of all our people? Are we creating a work environment that brings the best out of people and supports them? Or are we going to be in a work environment that buries the head in the sand when bad things are happening, nothing is done, and it continues to drain and become very toxic? So I believe this sort of opens our eyes to what has been happening. Maybe we've never voiced it, or it has been voiced in hushed places, but this is the time that we really need to look at what is happening in our healthcare profession. Are we entrenching some of these behaviors, and what can we do to address them? I think that's my last slide. Yes, thank you.
Thank you so much, Dr. Koki. We're now going to take some questions, if that's okay with you.
Yes, yes.
So the first question is from Kavo. They said, great presentation. However, why female doctors and not female healthcare workers? And is it only female doctors in Kenya who suffer from gender-based violence?
Okay, so, and I think I mentioned it, that this was just really an eye-opener, because I believe this is happening across the health space. I am a doctor, so I started with, my cohort of fellow female doctors, but this in no way means that this is only restricted, because I believe we have all women really face this kind of challenges. So this is an opportunity for further studies to look at the bigger healthcare system and see what is happening to women with the different cadres and so on. So I started with what was, the sector I am in is where I started. I hope that's clear.
Did you consider men?
No. For this one, I spoke to the women. We didn't get thoughts from the men. I started first by hearing what is the experience of the women. So this, again, being an exploratory study, opens the doors for so many other studies that can be done, looking, as you've said, in the other health cadres and the other health sectors, hearing from men. We may assume that they also don't undergo, discrimination and sexual harassment, or maybe we think it's very little. It could be a lot more. We don't know, but it opens the door for further research.
There's another question. Just to go on to that. For the response of being discriminated against because she was an intern, is it a gender issue or professional in terms of who is perceived junior versus senior in the workplace? This is from an anonymous attendee.
Okay, you see, this is again why the lines can be a bit blurred, because you are not sure whether you are being discriminated because of being junior or senior. But you see, if you are both male and female interns in a ward, but you will not be supported, but your male colleague who is at the same level as you is supported, that makes it a gender issue. It's no longer about seniority or, being a junior doctor. So that's where the differentiator was, because the male colleagues would be supported on ward rounds, but not her. So that's the difference. Although, again, that other bit could be considered, but for this particular situation, it was as said.
Thank you for that. Another question is, did the experience differ between private and public workplaces? And this is from Penina Kangau. I hope I've said your name correctly. So from your results, was there a difference between the public sector and the private sector?
No, there wasn't a significant difference, surprisingly. So it was like more or less the same based on the respondents. But again, as I mentioned, you notice there were only 83 respondents. Maybe if we had a bigger number, maybe could have been able to pick out the differences a bit more, depending on the sector and so on. But from what I had, it was more or less the same.
Oh, thank you. There's another question here from Jeremiah Okuto. He's asking, how did you manage your emotional involvement? You've been the researcher and you're a female doctor.
Okay. So first of all, these were self-administered. So I did not get to interact directly with the respondents. I just saw the results. But as I went through the results, I mean, I have seen it happening in the profession. So it was not a shocker to me. It was just that I didn't realize it was that much, because sometimes you may be a bit sheltered and not realize that very many people are undergoing. So what surprised me was the magnitude, but I knew it had been happening. I mean, I studied at the University of Nairobi, and I saw, and I mean, I work in this field, so I see these things. But the magnitude is what surprised me a bit, and therefore I feel it just opens the door for more. More needs to be done. I believe we've given it a lot of tokenism. I think, yes, we've been saying address gender discrimination, workplace inequality, and so on, but I don't think people have been very serious about enforcing it. So yeah, I think I was able to, I mean, it just affirmed what I had seen happening and just put numbers to it now, and you know, made it clear that it's something that needs to be addressed. And even I myself have ever experienced workplace inequality. There's a time I was paid less than my male colleagues. So it is real. You know, it has happened even to us. Yeah.
Thank you for that response. Another question is from Ali Owino. Can you discuss any institutional barriers or shortcomings within healthcare facilities that hinder effective prevention and response to gender-based violence cases involving both male and female providers?
Wow. Okay. Institutional barriers. Okay. I think for me, from what I've picked, and I'm not really an expert in this, but from what I've picked is, you see, when you start from a point of acknowledging you have a problem, then you start to address it. And I think this is an issue that has not been, you know, taken as seriously. And therefore, when we talk about let's address sexual harassment, you can see people getting away with it. You know, so-and-so has, you know, been, you know, engaged and harassed somebody, but they're still there. You know, there was no, there are no repercussions, you know. So I believe for me, institutionally, it's not just about saying, yes, we have a gender-based violence policy in place. Yes, you can have it. Okay, good. Are you enforcing it? Is it easy to report? Because if I am a female and I am going to report, and I'm going to report to maybe my supervisor or some men who are in charge of that, it might not be taken seriously, or I might decide, you know what, the repercussions of me reporting this might make it even worse for me. I better just keep quiet and look for another place to work. Yeah, so how is the reporting? Is it easy? Is there whistleblowing? Because sometimes if somebody is unable to report what is happening, somebody else can whistleblow and say, something is going on in this particular department and you need to look at it. But when it's raised, is it acted upon? And then can we see the consequences of that? Because again, as human beings, we know ourselves, you know, if there are no consequences, the majority of people will keep repeating the same things they're doing all over again. So I think those are some of the institutional barriers that are there, as well as even the training. So we talk about the training. So when we train, are we training just to tick a box that we say the training has been there? Or are we really empowering people and looking to see, as we train you, we are making sure that this can actually happen? So I believe we can do this a lot better. And it starts by acknowledging there's a problem and not just saying we are doing this for the sake of doing it. I don't know if that, I would say, you know, probably those are some of the barriers that would need to be addressed.
Yes, and I agree with you. And hopefully soon I'll be looking for you, because we conducted a study within Kenyatta National Hospital and currently we're analyzing the results. And yeah, some of the things is just like you had mentioned, whereby policies could be in place, but people are not being trained. Even when people are coming in, they do not know about the current policies that are in place. They don't know about the reporting strategies. So I totally agree with you, and maybe we can brainstorm in a later session. On to the next question. There's an anonymous attendee who is asking, your study is good, and this is from Kavo again. Your study is good for female doctors, but in one of your recommendation is for men. And there was no such evidence in your findings. I think, Kavo, what we are being told is that this was just a baseline, and so what we are being encouraged to do is, because since she did not look into other populations, it will be good to look into other populations, because maybe for men it's actually happening, it's just that they do not report. For Ali Owino, what are the key challenges faced by male healthcare providers in reporting incidents of gender-based violence, particularly when perpetrated against them by patients or colleagues? Ali, in this particular case, I think Dr. Koki mentioned that her population was especially for females. And so maybe this is a study that can be looked into in other studies, like maybe, for example, the study that you conducted in Kenyatta, and maybe we could answer this question at a later stage. So Alice Carrier is asking, was there any influence of previous sexual harassments on choice of specialty?
Yes, yes. So there was an influence because we were looking at if the experiences that you have undergone made you decide to choose the specialty that you went for. And yes, there was that influence. You saw that 46% were actually, their specialty was decided by what they had seen or experienced. And so looking at that, we didn't go into the details of actual whether it had happened to them or somebody they knew, but just looking at the exposure and what they said, you would see then a lot of them said, you know, surgical and obs and gynae were some of the two where a lot of them experienced that and maybe would make them shy away from selecting those specialties. So again, it's an area we can get deep into and see if there's can get some more findings around that.
Yes. Then there's another question from Peter Gishangi. How were the participants selected? What was the response rate? And was a sample size calculated for your study?
Yes, so the participants were, it was really just random. I got groups because they're organized groups of female doctors. So in various groups, I just introduced the study and, you know, asked them, can you fill this? So I went specifically for where female doctors were in different groups. Yes, we had a sample size and the response rate, let me confirm, the response rate was about 30%. And that's why I said this was really exploratory. It just opened the doors and we need to do more of this and figure out what is happening. Yeah.
There's somebody who is asking, from Alvin Omuya, what are your short-term suggestions on addressing the sexual harassment issues? I think this was part of your recommendations, but you can repeat that for him.
Yes, so I think short-term recommendations is for us to go back, because we all work within an institutional framework, look and see what is happening in the different institutions. Do we have policies in place? Are they easy to understand? Are people oriented on what sexual harassment is and what discrimination is? Is there a training? And if the trainings are happening, are they really effective trainings, and what can be done better? Because I think that's the first place to start, because we all need to work within frameworks. So looking at our policies, looking at the shortcomings, is it that it's not easy to report to, or who are we even supposed to report to? And when you report, is there confidentiality around that, or does everybody get to know you report? So those are the things I would say would be the immediate things to look at, because when you have that framework in place, then now you can begin to enforce it, because then you've built people's capacity, they know what is right and what is wrong, and there's a channel to report it, and therefore if you don't do that, there are consequences, and the consequences must be enforced. Otherwise, then everything you'd have done would have been in vain. So I'd say that really would be the starting point.
Okay, there's somebody who is asking if, in case of your study, if you had any selection bias, because mostly you chose women, and this is from Invioleta Makano. You chose women who are female doctors. So they're asking about how you managed that biasness of selecting just female doctors.
Okay, yeah. So my study was actually just targeting female doctors. So that's why I went straight for them. And I was looking for women doctors who had trained in Kenya and were working in Kenya. So that was the focus. But this being, as I was saying, an exploratory study, opens the door to look at more broader gender violence within the health sector. And now this can cut across the different specialties in health. It can even look at men and not just women. So this was really just trying to figure out the things that have been unsaid. Can we start to say them? Because then it shows that we need to do some more research around it. So it was for the female doctors specifically, but as a start.
Okay, we have some participants who are asking if you could share your slides. I don't know how you'll respond to that.
Yeah, sure. I can share them, no problem. I think I'll send them and then you'll circulate.
Yes, you can send them to the department, then they'll be circulated.
Okay, I'll do that.
Then for this anonymous attendee who is asking, do you think it will help if students are made aware of reporting mechanisms during undergraduate training? I'll recommend that sexual harassment policy is made to be trained to everyone who is within that particular institution, so that it does not matter whether you're an undergrad, you're the most junior staff. The sexual harassment policy should be trained to all people within that institution.
Yes, and maybe I can add a bit to that. The study actually showed there was a lot of this happening in undergraduate and postgraduate training. So I agree, we have to be deliberate to create awareness for the students. It doesn't matter whether you're a first year or you've come back as a postgraduate student. That channel needs to be there so that you don't feel disempowered and things are happening to you and you can't talk about it and you have no idea. So it's true, it has to cut across all the students and, as we say, all the workers. This is for everybody who's working in an institution. We should not imagine that there are certain obvious victims of sexual harassment and there are others who are not obvious. No, everyone is potentially a victim. So we need to make sure we are inclusive in training, in having the policies in place, enforcing. So let's not leave anyone out.
Thank you, Dr. Koki. I have a question. Do we refer to those ones who've undergone sexual harassment as victims or survivors?
Yeah, I think should be survivors, eh?
Yeah,
I think that's the correct word, isn't it?
Yeah, it's the correct
Survivors.
Terminology.
Yes, yes.
Yeah, and I don't know if this was within the scope of your study, whereby you asked your participants, for those ones who had possibly reported to have undergone sexual harassment. I don't know if you are able to probe to find out how they were able to attend to their patients.
No. That was one of the limitations because I simply went for the quantitative data. We filled in the questionnaires. I didn't explore, and that's something that would really be useful in further research, being able to actually get to hear how did that impact, on work, and not just even on work, even on your own, just social self, your relationships with other people, because surviving gender-based violence, it has an effect on you, and not just on the output, but even maybe future relationships. So that's an area I think that would be good to explore in future research.
Yeah, and I agree with you because sexual harassment has actually been found to be one of the things that makes people to lack motivation, and it affects not only their work life, but also their personal lives and social lives. And I totally agree with you. So for the participants, and this is from Sharon Monda, for the participants that were included in your study, were they from different parts of the country or from within specific counties?
No, they were all across.
Or they were across the country and from different counties?
Yes. But currently working in Kenya.
Okay. So for this particular presentation, maybe you can comment on, since you're an expert on this, maybe you can comment on what a survivor should do in terms of what they should do next if they were to encounter sexual harassment. And this is just for learning purposes for everyone within the forum.
Okay, thank you. I don't think I'm an expert, but I can share what I think can be done, and you can chip in as well, Dr. I think the first thing is, if this happens as a survivor, you need to acknowledge that what has happened is not right. It's not your fault, because I think a lot of times there's self-guilt and shame and so on that really you are ascribing to yourself problems that are really like not yours. You ask yourself, maybe I deserved it and so on. So I think the first point is to acknowledge what has happened. And then now, if you are within a setup that allows you to report, you need to do that. Because why a lot of people get away with continued discrimination, continued sexual harassment, is because nobody is talking about it. You know it's happening, you know who is perpetrating it, but it is not said. And sometimes the survivor may not be able to say it, but you who has seen it should be able to say, yeah, you should be able to report. I believe it is not right for us to be witnessing these things happening and you wait for somebody to report it. Why can't you be the one to report that there is sexual harassment going on here? I have a colleague who is, who's been exposed to this and so on. So that's the other thing. And then I would also say, as a survivor, it is important to get help. As we said, it affects you. It affects your work. It affects your social life. It affects you as a person. You'll always be like, why me? Did I deserve it? Maybe something is wrong with me, and so on. So it's important to go for counseling. It's good to discuss that and get closure around it, because otherwise it's something you will carry for the rest of your life, which is quite unnecessary. Because really what happened to you was undeserved, but you need to survive and thrive. So I would say getting help to address it. People tend to minimize some of these things, as we had mentioned earlier. Some of these things people will be like, I mean, you're not the first, you're not the last, so what's the big deal? So it may be minimized, but the impact is there. So I believe being able to talk about it, get help, report, and if you see it happening, report on behalf of that person. Sometimes somebody may actually be in a space where they can't do it themselves, but I mean, the rest of you, somebody else saw it. And so that's why we need the system, we need the institutions to have ways to support this whistleblowing and, allow somebody to come and report without any repercussions, because again, you don't want to lose your job because of reporting what happened to you. So we need to ensure that everyone feels safe and supported in the workplace. Dr. Anne, I don't know what else you can add to that one.
No, I totally agree with that. And especially for sexual violence, people should actually immediately report to the gender-based violence center, get treatment, and also at times you can also report to the police. And then now thereafter you need to follow up with the workplace. I was just going to add on to that. Maybe that's the one thing that you missed about the sexual violence incidents.
Yes, that's true. Thank you.
Yeah, because you need to be reported to the police. Then for the participants within the forum, kindly note that sexual harassment can happen to anyone. And by anyone, I mean it can happen to female workers and it can also happen to male workers. It's just that most of the evidence and most of the studies have been conducted among women, showing that there's a high prevalence of sexual harassment among the women, and that is from long time ago. But also please note that women can also be perpetrators of sexual harassment. And please note that sexual harassment can also happen not only to the same, it can happen in terms of like if the female, if men have a female boss, that can also happen whereby the female boss can sexually harass the junior. So please note, just because she was presenting a study among female doctors, it does not mean that sexual harassment does not also happen to men. It's just that evidence shows that sexual harassment happens to men, but they rarely report it. And again, there's also the norms whereby that men are not expected to be sexually harassed, but it happens. So I just wanted to add on to that. I don't know if Dr. Koki wanted to add anything onto that.
Yes, I do. I agree. Of course, if you look at the proportion, most of the gender-based violence is perpetrated against women, but an increasing number of men are also, facing this. And I think the patriarchal society, again, that I mentioned, that sort of normalizes some of these things, is the same one that is not supportive of men when they encounter or when they survive sexual harassment. Because, even being able to open up to a fellow man and tell him that happened, it becomes a laughing stock. They can't believe, the way everything is taken very lightly, because it's assumed that you're the one who's supposed to be the one perpetrating it, not being the other way around, so the jokes and everything. So it is actually a big concern. And so that's why I said towards the end in my recommendations that we need to make the workplace safe for both men and women. Yeah, because we know it happens. And until we talk about it, then that's only when people will start to realize that we actually need to do something about it. So let's not forget the men. We do have men who have found themselves in very difficult situations and they don't have anyone to talk to, and they can't even open up because it becomes a whole nightmare for them, but they also equally need the support. And so I'd also encourage that if there's any man, going through that, I mean, there's support, there's counseling, you can reach out and get help. It's not something to keep quiet about, help is available. Thank you.
Yeah, thank you so much for that presentation. I hope we'll be presenting our results soon, because for us, we were also able to conduct, it was like we included everyone. It was inclusive of all healthcare providers. So hopefully we're analyzing our results, and maybe we can present our results soon. Then it can complement your study, and maybe we can have a cup of tea and look at each other's results. And maybe I'll
Yes,
cite your paper.
I look
So
forward to
I
it.
don't so I don't think there are any more questions. Without further ado, I think that was a very informative session, and we thank you so much for this session, and hopefully we'll be looking for your paper once you publish it.
Yes, I will make sure I publish soon.
Yes.
Thank you.
Yeah, and thank you so much. I think now we can say goodbye to everyone. And actually, we had many people in the audience. We had we had 1,000 people in the audience. So your presentation was well attended, and so we hope to see a publication soon, so that we can also be able to cite your work. And hopefully, from this, other people can set up sexual harassment policies in their institutions. Thank you so much for such an informative presentation. And I'd like to say good night to all of you. Good night and goodbye. Till next time. Thank you, Doc.
Thank
Kwaheri.
you, Dr. Asante sana.
Sawa sawa. Bye.
Bye.